The Tennesseans who have both Medicare and TennCare could soon have to make changes to keep the extra benefits they rely on. A new state requirement is aiming to streamline coverage by having both plans handled by the same insurance company. Insurance agent Micah Doherty says the goal is to simplify care and cut down on billing headaches. But if someone doesn't make that switch in time, they could be dropped from their D-SNP plan and then moved back to the original Medicare.
You're at risk of losing your D-SNP benefits, which for most people that are disabled and seniors helps pay for their electricity, their groceries, their dental care, transportation to and from the doctor, durable medical equipment.
He says anyone who gets a letter should read it very closely and take action early because aligning Medicare and TennCare coverage can take weeks, and then waiting could lead to gaps in your benefits.